it's Jessica DeMassa with WTF Health, and with me right now I have Eric Maroyka. He is the Director for the Center on Pharmacy Practice Advancement for ASHP. So Eric, great to have you here.
Thank you, Jessica.
All right, so we are going to talk all things future of the pharmacy, and one of the things I'm really interested in hearing about is, so ASHP has kind of reissued a Practice Advancement Initiative. Tell me a little bit about this and some of the highlights of it.
Sure. So ASHP has a long history of consensus building events, but more recently, within the past decade, ASHP undertook a great consensus conference called the Pharmacy Practice Model Initiative. And then shortly following that, it resulted in the Ambulatory Care Summit. So collectively, that resulted in 172 points of consensus, which included recommendations. Well, we've reached that nearly a decade mark in existence, and there's been a lot of healthcare disruption. The landscape is changing. There are technology transformation that's occurring. We also have population health, which is of great consequence to the health and well-being of people, and it has a financial tail and burden that we need to be responsible stewards for. So the PAI2030 is a forward-looking, aspirational look at recommendations that are more strategic in focus. They're not necessarily tactical, and they focus on overcoming barriers in the future, not being fixated on them today.
Okay.
So they provide 59 recommendations that will allow pharmacists, organizations, and the profession to look forward to position the profession and the care of patients in a positive light for lasting success as part of an interprofessional care team.
Okay, so before we jump in, I want to hear some of the highlights of these recommendations. But before we do, I want to, set the context around it. Who are these recommendations for, the 59 strategic guidelines? Are these for a health system? Are they for the pharmacist? Like, how are they meant to be used?
Yeah, so ASHP, largely represents hospitals and health systems, but really it's looking at the entire continuum of care. So we have pharmacists and members that practice in specialty pharmacy and ambulatory care settings as part of a community pharmacy that may be integrated with a hospital, but we're really looking for integrated end-to-end care that is patient-centered, that is precise to their needs, that takes into account consumerism. Some of the other themes that really can be drawn from the recommendations are about all patients having access to the care of a pharmacist to provide comprehensive medication management. Data science is huge, the use of big data to turn that into information. That includes the Internet of Things, really digitals, wearables, ingestibles, taking an active role in that, and really building a cadre of data scientists from our pharmacists. We have to go away from a focus on a commodity producing profession such as supply chain, although supply chain is important, to a service delivery type of profession that also expands out into new areas, pharmacogenomics, taking ownership of that, in addition to working closely with the interprofessional care team, being very patient-centered, finding care that's convenient and cost-effective for patients in a place and time that's convenient for them. We really bring a unique skill set that can be leveraged to provide an added layer of patient-centeredness to the patients we serve.
So for those who may not be really familiar with the role of pharmacy, particularly in a health system, I have a big innovation crowd that watches, and so we're very much focused on this digital disruption and transformation space. But can you give us a state of play of how revolutionary these recommendations are for somebody who might be a pharmacist in a health system, or for a health system trying to update the technology and integrate some of these things that you mentioned, wearables, ingestibles, even some of the population health, AI that drives the data science behind that. How revolutionary are these guidelines for pharmacy the way it is today?
Well, I just want to stress again that they're not tactical in nature.
Yeah.
However, they are strategic in focus, and they will be part of an organization or individual pharmacist portfolio for determining goals and objectives looking forward. We will have a self-assessment that essentially is a gap analysis tool that will be released in early 2020. Right now we have the legacy tools, the hospital and ambulatory care self-assessments. In addition to the recommendations, because we don't want to necessarily overwhelm a small and rural or maybe even a large health system for that matter, we will have focused initiatives that emerge. And these focused initiatives are time-bound, and they're intended to minimize the static nature of the recommendations themselves. I don't want to release any premature ideas on these, but these are bold aims, and they're loosely based on the CMS Partnership for Patients and Cotter's publication of an accelerator network to really establish strategic agility to find success in a rapidly disruptive and changing world. So I think they're exciting from that matter, and they allow us to be agile and allow leaders and individual pharmacists and organizations, health systems, focus on those elements that are important to them, and then they can change them as conditions evolve. So,
why is it important, you think, for the ASHP to weigh in on this now? I mean, I know you said that those recommendations were 10 years old. I mean, a lot has happened, though, in those 10 years. I mean, even if you just look at the integration of EMR, I mean, why now? I mean, do you feel like we've hit kind of a tipping point in terms of technology?
Yeah, absolutely. It's exponential change, and we need to be part of the disruptor, not the disrupted. I mean, it's in a world where there are other disruptors out there that have mastered supply chain discipline, that have superior customer service experience, and are masters of data analysis and analytics. We need to take a page out of those playbooks and really arm our enterprises with that type of discipline and focus. We are still committed to the patient as the core, and everything that you work backwards from the patient, it needs to be at the forefront of what we do, from safety, quality, leadership. But demonstrating leadership from an official position to an individual practitioner, it's going to be required to be bold in our commitment to overcoming barriers today, but keeping an eye on the future. Otherwise, someone else will figure it out, and we may do it collectively as a team, or we may need to put a stake in the ground and establish kind of our leadership in an area. And ASHP has a long history of being a leader in many aspects of pharmacy practice.
I get so excited when I hear about people becoming innovative. I love it. So I wanted to ask you, I mean, the recommendations, there's 59 of them. I know they're strategic in nature, not tactical. Are there any that you feel like, when you're looking at the body of that work, like a smart place to start? So maybe for all of the pharmacists who are watching, the health system, leaders that might be watching this, is there a place with those recommendations that, you're like, maybe these are the ones to pay attention to, or do you have a favorite in terms of, if we did this and went this way, this would be completely eye-opening and the whole thing would just cascade more smoothly?
I don't have a particular favorite, and some of the focused initiatives that I had mentioned, that those will help sharpen the focus for some institutions, but others will be ready to take them on in mass, quite frankly. But they're arranged in 5 domains. So we have patient-centered care, which we feel is really the most important of the domain. So if I had to say, a collection of recommendations, patient-centered care, because that's why we exist. Next is developing the skill sets and roles of a pharmacist. So there's the pharmacist role in education and training. And then, of course, technology, we have to embrace it. We cannot, you have to dive in. And the data science, whether we develop our own cadre of data scientists within or we have access to them, that is going to be a critical component. And then the pharmacy technician. I mean, making that more of a professional career path that's established, and not just a job, but it's that is where we've had a commitment through other kind of conferences and events and accredited training and education. You will see the rise of the pharmacy technician essentially. That will really revolutionize the supply chain and some of the operational aspects of the pharmacy that maybe the traditional pharmacy function has taken on. That will be essentially handed over to pharmacy technicians. And then lastly, leadership in medication use and safety. Safety is again obviously important. Effective stewardship of medication use, and also being having a finger on the pulse of financial and clinical outcomes, quality measures. These are all absolutely important. And as an enterprise, you will have to have a highly functioning team that you're able to delegate and prioritize. So part of the self-assessment that we will create will allow you to have an action plan that you could determine feasibility and impact, and it'll categorize out what are the high impact areas that you should focus on first, or suggest it. You will have to make that determination with your staff and the direction of your organization that's aligned with the strategic plan of a health system or an organization, or you as an individual practitioner that may be practicing in a physician group, for instance.
It's exciting, though, that ASHP has taken the step of providing this framework, and I love the fact that you actually have this self-assessment tool that is being built to help provide an action plan. I mean, I think, talking to a lot of innovators in healthcare, that's often, their biggest complaint, the technologists who are entering into this space is they don't often know how to interact, with the health system as it is in order to kind of mitigate the divide, and vice versa. So those who are in a healthcare, like in an established health player organization, they don't often know how do we bring some of this stuff in, what should we be looking at. So it's great that you guys have provided this framework.
Yeah, and even though in our title it's health system pharmacist, we really want to represent all pharmacists in all settings of care. The exciting part is, as a membership organization, we have 50,000 plus members. So we really have an army of volunteers out there, and we want those emerging best practices, and we'll determine the best media and channels to do that, but it could be through webinars or podcasts or videos like this. And we want to hear those so that they're incubators for emerging best practice. And it might be a pharmacy in Idaho is doing something really innovative, and maybe somewhere in Alabama is like, how do we figure this out? Well, hey, we have a resource here that you can have a playbook for that might not entirely work for your setting, but it'll give you ideas to get to best practice.
I love it. Eric, thank you so much for stopping by and talking about this, the Practice Advancement Initiative. Thank you so much.
Thank you.
I'm Jessica DeMassa with WTF Health. Thanks for joining us.